Sickle cell is an inherited condition. Patients are born with this condition. They will live with this condition all of their lives. In the UK, we essentially have two treatments, either blood transfusion or hydroxycarbamide. They're both effective treatments, but they're not cures. This trial is looking to help us establish an option of a cure for this condition, and this is why it's so essential.
I never know if I'm going to get a good day with it or a bad day with it. I had a sickle crisis whilst out just getting the weekly shot. I locked up so much that I could barely walk.
Sickle cell disease is a genetic disorder where red blood cells become sickle-shaped, blocking blood flow and causing pain and complications known as a sickle cell crisis.
So crisis means for sickle cell, it's like being under sort of excruciating pain. It's almost like like I said, I go to the gym, so it's almost like having that sort of muscle soreness, but just never goes away.
I'm up and down in pain all the time, and just staying on painkillers, it's not a way to live.
There is a cure for sickle cell. The presentation of the condition in people who have it is because it affects their stem cells. So actually, if we can give them stem cells that don't have the sickle condition, then they won't express the sickle condition, basically.
This trial is looking at trying to assess the benefit of stem cell transplantation for patients with sickle cell disease. So in order to do a stem cell transplant, we need to collect stem cells from a donor, and then we would give them to the patient who had sickle cell disease. And then after a period of about 2 to 3 weeks, we would expect that a person will be able to discharge from hospital. And we would expect by that time the new stem cells will have grown within the patient and produce red cells that don't have the sickling capability. So they would free the patient from sickle cell disease. Prior to giving them to the patient, there's a period of something called conditioning chemotherapy. This involves chemotherapy drugs and immunosuppressive drugs, and these prepare the patient's body to be able to receive the stem cells and so that they don't reject the stem cells. For most people, we would look for what's called a fully matched sibling donor, but the problem is that most people won't actually have a fully matched sibling donor. So that's why in recent years we've worked out that half-matched donors, if they're related to you, also work.
Our immune system uses HLA markers on the surface of cells to recognise which cells belong to our body. You inherit half of these markers from your mother and half from your father. HLA matching is important for successful organ and stem cell transplants because a close match reduces the risk of the body rejecting the transplant. A full match stem cell donor would be a brother or sister who has the same HLA markers as you, inherited from your parents. However, there is only a 25% chance that a sibling will be a full match. A haploidentical, half-matched donor shares about half of these markers with you. The chance of finding one is relatively high and could be a parent, child, sibling, or even a cousin, including those with the sickle cell trait.
At the moment, if you had a fully matched donor, sibling donor, then that would be funded on the NHS, but a half-matched donor is not yet funded. So that's also why we're doing the trial, to try and expand the donor options so that we can use them for transplantation as a cure for sickle cell disease.
A new treatment would mean a new life. I would be back to my old self, not afraid to try things.
If the treatment was available on the NHS, that would be amazing. I know like some of these treatments are very costly, and I think that kind of brings account to another benefit of having treatment options, to know that it's available, it works. Now, how do we get it?
To take part in the REDRESS trial, you have to have the sickle cell disorder, basically. There is no upper age limit, but you do have to be an adult, so you have to be at least 18, but there is no upper age limit for it. You have to have a 50% match donor who is happy to donate stem cells for you, and that donor can't have the sickle cell disorder themselves. They can be a carrier, they can have sickle cell trait, that's not a problem, but they just can't have condition. If you're interested in taking part in the REDRESS trial, just speak to your sickle cell team. You can Also find out more information by going to the REDRESS trial website and having a look and a read up there. And once you're on the website, you can also contact the team who are running the trial to get more information.